switch gears here a little bit to peripheral arterial disease, all coming under the classification of peripheral vascular disease. Okay? But if it's peripheral arterial, let's talk about the most common cause in this, up and down the body, will be atherosclerosis. Atherosclerosis, we had a discussion in terms of the pathogenesis of an atheroma, including the fact that there was endothelial injury within a blood vessel, resulting in a thrombi formation, resulting in recruitment of some of those smooth muscle cells coming from the media to the intima, all contributing to the fibrous cap. Do you remember that discussion? If not, then it might be a good idea for you to go back and take a look at, well, what is the developmental process of an atheroma? Now, once you understand the developmental process, you can go ahead and put that atherosclerotic plaque in many blood vessels, and therefore bring about the clinical manifestations of that blood vessel involved. For example, if it is peripheral arterial disease, then you know your patient is going to suffer from, quote-unquote, angina of the leg. In other words, claudication. If it is coronary arterial disease, then that would be something like your angina for sure with chest pain, or erectile dysfunction, or issues with transient ischemic attack, right? Up and down the body, atherosclerosis. But here, let's focus upon the periphery, shall we? Some patients develop ischemia, and if it's bad enough, could result in severe issues to the point where perhaps there's even gangrene. You don't want that. Now, like coronary artery, the symptoms are going to be the same thing that we saw earlier for angina, and our discussion there brought us into two major physiologic classification. It was the supply and the demand. The supply and the demand. The more that there's demand, you need to make sure that you provide supply. Isn't that how business works? Correct? So therefore, you're demanding excellence. I'm hopefully supplying you with that information. The demand here has increased. Maybe the supply isn't sufficient. So why? Coronary arterial disease? That's what you saw with angina. The same type of issue might be taking place in the peripheral artery. So what's the patient going to feel? Pain. What do we call this? Claudication. Shall we?